Hey everyone, welcome back to Speak Healthy. Today, we will talk about chronic obstructive pulmonary disease and how to effectively treat and recognize it. Chronic obstructive pulmonary disease, or COPD, is a chronic respiratory condition that affects millions of people worldwide. COPD exacerbations, or flare-ups, are sudden worsening of symptoms that can cause significant morbidity and mortality in affected individuals. COPD exacerbations can be triggered by various factors, including infections, environmental pollutants, and changes in weather. It is essential for individuals with COPD and their caregivers to recognize the signs and symptoms of exacerbations and know how to manage them. Early recognition and prompt management of COPD exacerbations can help reduce the severity of symptoms, prevent hospitalizations, and improve quality of life. In this video, we will discuss the signs and symptoms of COPD exacerbations and provide practical tips on how to manage them. Number 1. What is COPD? COPD, or chronic obstructive pulmonary disease, is a chronic respiratory disease that affects the lungs and airways. It is characterized by persistent respiratory symptoms and airflow limitation that is not fully reversible. COPD is caused by long-term exposure to irritating gases and particles, usually from cigarette smoking, but can also be caused by exposure to air pollution, dust, and chemicals. The symptoms of COPD include shortness of breath, coughing, wheezing, and chest tightness. These symptoms can worsen over time and can lead to significant disability and reduced quality of life. In severe cases, COPD can also cause respiratory failure and require oxygen therapy or mechanical ventilation. There are two main types of COPD: chronic bronchitis and emphysema. Chronic bronchitis is characterized by a chronic cough and excessive production of mucus in the airways, leading to a narrowing of the air passages. Emphysema is characterized by the destruction of the small air sacs in the lungs, making it difficult to breathe. In many cases, individuals with COPD will have a combination of chronic bronchitis and emphysema. The diagnosis of COPD is usually made based on a combination of symptoms, medical history, physical exam, and lung function tests. Lung function tests, such as spirometry, measure the amount of air a person can exhale and how quickly they can exhale it. In some cases, additional tests such as chest x-rays or CT scans may be needed to rule out other conditions that can mimic COPD. Number 2. What are COPD exacerbations? COPD exacerbations are episodes of acute worsening of respiratory symptoms in individuals with COPD. These flare-ups are characterized by an increase in coughing, shortness of breath, wheezing, chest tightness, and increased production of sputum or phlegm. Exacerbations can vary in severity and duration, and some may require hospitalization or emergency medical attention. COPD exacerbations differ from regular COPD symptoms in their intensity and duration. Regular COPD symptoms are chronic and persistent, while exacerbations are acute and temporary. Exacerbations can significantly worsen an individual's respiratory function and can cause significant morbidity and mortality. Several factors can trigger COPD exacerbations, including respiratory infections such as pneumonia or the flu, exposure to air pollution or environmental irritants, changes in weather or temperature, and non-adherence to medication or treatment plans. In some cases, exacerbations may occur spontaneously without an identifiable trigger. COPD exacerbations can be dangerous for several reasons. They can lead to a further decline in lung function, which can result in hospitalization, the need for mechanical ventilation, and even death. Exacerbations can also cause significant distress and anxiety for individuals with COPD and their caregivers, as they can disrupt daily activities, lead to missed work or school, and require additional medical treatment. Effective management of COPD exacerbations is essential to prevent complications and improve outcomes. Individuals with COPD and their caregivers should be vigilant in monitoring for signs of exacerbations and should seek medical attention promptly if they occur. Treatment of exacerbations may include medications such as bronchodilators, steroids, and antibiotics, as well as supplemental oxygen therapy and breathing exercises. Number 3. How to recognize exacerbations. Recognizing the signs and symptoms of a COPD exacerbation is critical to prompt medical intervention and management. The following are some common signs and symptoms that may indicate a COPD exacerbation is occurring. Increased shortness of breath. A sudden increase in the feeling of breathlessness, especially during daily activities that were previously easy to do, may indicate an exacerbation. Worsening cough. If a chronic cough gets worse or produces more mucus than usual, this may indicate an exacerbation. Increased mucus production. An increase in the amount of mucus produced or a change in its color, thickness, or odor may indicate an exacerbation. Chest tightness or pain. Individuals with COPD may experience chest tightness or pain during exacerbation. Wheezing. Wheezing is a whistling sound that occurs when air flows through narrowed airways. Individuals with COPD may experience wheezing during exacerbation. Fatigue. Individuals with COPD may feel more tired or lethargic than usual during exacerbation. Bluish lips or fingernails. A bluish tinge to the lips or fingernails may indicate a lack of oxygen in the blood, which can occur during an exacerbation. It is important for individuals with COPD and their caregivers to be vigilant in monitoring for these signs and symptoms because prompt medical intervention can help manage the exacerbation and prevent complications. If left untreated, exacerbations can lead to hospitalization, respiratory failure, and even death. In addition, individuals with COPD should be aware of their personal triggers for exacerbations, such as exposure to air pollution or respiratory infections, and take steps to avoid or minimize these triggers. They should also have a written action plan in place that outlines what to do if an exacerbation occurs, including when to seek medical attention and what medications to take. Number 4. How to manage COPD exacerbations. Effective management of COPD exacerbations is crucial to prevent complications and improve outcomes. The following are some strategies that can be used to manage a COPD exacerbation. Medications. Bronchodilators, corticosteroids, and antibiotics may be used to treat the underlying inflammation and infection that contribute to an exacerbation. These medications can be delivered through inhalers, nebulizers, or oral tablets. Oxygen therapy. Oxygen therapy may be necessary to increase oxygen levels in the blood and improve respiratory function. Oxygen can be delivered through a nasal cannula or face mask. Breathing exercises. Breathing exercises such as pursed lip breathing and diaphragmatic breathing can help improve lung function and reduce shortness of breath during an exacerbation. Avoiding triggers. If the exacerbation is triggered by exposure to air pollution, smoke, or other environmental irritants, individuals with COPD should take steps to avoid or minimize exposure. Emergency services. In severe cases, emergency medical services may be necessary to provide immediate medical attention, including oxygen therapy, medications, and transport to the hospital. Hospitalization. Hospitalization may be necessary for individuals with severe exacerbations who require close monitoring, mechanical ventilation, or other intensive medical interventions. In addition, individuals with COPD should have a written action plan in place that outlines what to do if an exacerbation occurs. This plan should include instructions on when to seek medical attention, what medications to take, and any other necessary steps to manage the exacerbation. Number 5. Tips for preventing COPD exacerbations. Preventing COPD exacerbation is an important aspect of managing the condition. Individuals with COPD can take several steps to reduce their risk of exacerbations. Here are some tips. Quit smoking. Smoking is the leading cause of COPD and can worsen symptoms and increase the risk of exacerbations. Quitting smoking is the most important step individuals with COPD can take to improve their lung function and reduce the risk of exacerbations. Avoid triggers. Environmental triggers such as air pollution, respiratory infections, and allergens can exacerbate COPD symptoms and increase the risk of exacerbations. Individuals with COPD should avoid these triggers as much as possible. Stay up to date on vaccinations. Vaccinations such as the flu and pneumonia vaccines can help prevent respiratory infections and reduce the risk of exacerbations. Maintain a healthy lifestyle. A healthy lifestyle can help improve overall health and reduce the risk of exacerbations. This includes maintaining a healthy weight, getting regular exercise, and eating a balanced diet. Take medications as prescribed. Medications such as bronchodilators and corticosteroids can help manage COPD symptoms and reduce the risk of exacerbations. It is important to take these medications as prescribed by a healthcare provider. Use oxygen therapy as prescribed. Oxygen therapy can help improve respiratory function and reduce the risk of exacerbations in individuals with severe COPD. It is important to use oxygen therapy as prescribed by a healthcare provider. Monitor symptoms. Individuals with COPD should monitor their symptoms and seek medical attention if their symptoms worsen or if they experience new symptoms. Early intervention can help prevent exacerbations and improve outcomes. Number 6. The impact of COPD exacerbations on the quality of life. COPD exacerbations can have a significant impact on an individual's quality of life. Exacerbations can cause a sudden worsening of symptoms such as coughing, wheezing, shortness of breath, and fatigue. This can make it difficult for individuals to perform daily activities, including work, exercise, and social activities. Individuals with COPD may experience limitations in their ability to work, as exacerbations can make it difficult to perform physical tasks or to concentrate. This can lead to missed work days or even disability. Exacerbations can also limit an individual's ability to exercise, which can lead to a decline in physical fitness and muscle weakness. Social activities may also be impacted by COPD exacerbations. Individuals with COPD may avoid social situations due to their symptoms or fear of exacerbations. This can lead to social isolation and a decreased quality of life. In addition to physical limitations, COPD exacerbations can also take an emotional toll on individuals and their caregivers. Exacerbations can cause anxiety, depression, and stress, which can further impact an individual's quality of life. Caregivers may also experience emotional distress and a burden of care, as they often play a significant role in managing exacerbations and supporting the individual with COPD. Number 7. The importance of COPD management. In general, COPD is a chronic and progressive respiratory disease that can have a significant impact on an individual's quality of life. Effective COPD management is essential in order to minimize symptoms, prevent exacerbations, and maintain overall health and well-being. A comprehensive COPD management plan should include regular checkups with healthcare providers, medication management, and lifestyle changes. Regular checkups with healthcare providers allow for monitoring of symptoms and disease progression, as well as adjustments to treatment plans as needed. Medication management is important to ensure that individuals are receiving the appropriate medications to manage their symptoms and prevent exacerbations. Lifestyle changes such as quitting smoking, avoiding triggers, and staying up to date on vaccinations can also help to prevent exacerbations and improve overall health. Self-care and self-management also play an important role in COPD management. Individuals with COPD should be educated on self-management techniques such as breathing exercises and relaxation techniques, which can help to reduce symptoms and prevent exacerbations. It is also important for individuals with COPD to monitor their symptoms and to seek medical attention if their symptoms worsen or if new symptoms develop. Effective COPD management can have a significant impact on an individual's quality of life. It can improve symptoms, reduce exacerbations, and help individuals to maintain their independence and engage in activities that are important to them. In addition, effective COPD management can also reduce healthcare costs and improve overall healthcare outcomes.